Today, we're diving into a very common set of questions that many people have, but don't always feel comfortable asking openly. Are you waking up multiple times during the night to urinate? Have you ever wondered whether those so-called gas station pills actually work, or if they're even safe? And maybe you've noticed changes in your partner's mood and wondered if it could be something like menopause? Well, in today's Ask Me Anything episode, we're going to break all of that down in a clear, practical, and science-based way so you can actually understand what's happening in your body and what you can do about it. Part 1. Waking up at night to pee, nocturia. Let's start with the first question. I keep waking up multiple times at night to pee. Even when I stop drinking water early, it still happens. What's going on? This is extremely common, especially as people get older. But before we talk about what's wrong, we need to understand what's normal. Around your 40s and 50s, waking up once per night to urinate is considered normal. Why does this happen? As you age, your body produces more of a hormone-like substance called atrial natriuretic peptide, ANP. This chemical signal tells your kidneys to produce more urine at night. So instead of making most of your urine during the day, your body starts shifting some of that production into nighttime hours. That means your bladder fills more at night. You're more likely to wake up at least once. That's normal. When does it become a problem? If you're waking up 2 or more times per night, that's when we consider it abnormal and worth evaluating. Common causes. 1. Enlarged prostate, BPH. One of the most common reasons in men is benign prostatic hyperplasia, BPH. About 50% of men over 50 have it. Around 80% of men in their 70s have it. When the prostate enlarges, it blocks urine flow, prevents complete bladder emptying, causes frequent urination. Symptoms include weak stream, starting, stopping flow, feeling like you didn't empty completely. So when you go to bed, your bladder fills faster, and you wake up more often. 2. Overactive bladder. Sometimes it's not just blockage, it's bladder behavior. Your bladder becomes overactive because it's been working too hard for too long. This leads to sudden urges, frequent urination, nighttime waking. What you can do at home. Before medications or surgery, try these. 1. Limit fluids before bed. Stop drinking 2 to 3 hours before sleep. 2. Watch what you drink. Avoid caffeine, alcohol. These irritate the bladder and worsen symptoms. 3. Identify trigger foods. Possible irritants, spicy foods, citrus, artificial sweeteners, tomato-based foods. Don't eliminate everything. Experiment one at a time. 4. Treat constipation. This is huge and often ignored. A full rectum pushes against the bladder. More urgency. Solutions. Increase fiber. Stay hydrated. Consider supplements. 5. Hydration balance. Too little, like concentrated urine. Irritation, too much. Like frequent urination. Aim for light yellow. Lemonade-colored urine. 6. Weight and smoking. Weight loss improves symptoms. Smoking irritates bladder and increases cancer risk. Medical options. If lifestyle changes don't help, alpha blockers, relax prostate, 5 alpha reductase inhibitors, shrink prostate, daily tadalafil, Cialis, improves urine flow. For bladder, relaxation medications, preferred, older meds, more side effects, advanced options, minimally invasive procedures, prostate artery embolization, surgical treatments. There are many solutions. Don't ignore the problem. Part 2. Gas station pills, ED supplements. Let's talk about those pills you see at gas stations. Short answer, they are not safe. Why? They're dangerous. Many contain undisclosed ingredients, high doses of prescription drugs, unregulated compounds. They don't go through proper safety testing. Biggest risks: blood pressure drops, dangerous drug interactions, unknown side effects. Some are only removed after harm is reported. What actually works? Instead of risky supplements, talk to your doctor. Use FDA-approved medications like sildenafil, Viagra, tadalafil, Cialis. These are now very affordable and safe when prescribed properly. Important insight: Erectile dysfunction is often an early warning sign of heart disease, high blood pressure, diabetes, high cholesterol. Don't ignore it. Use it as a signal to improve your health. Part 3. Partner mood changes in menopause. Now let's talk about your partner. She's 51 and her mood has changed. Could this be menopause? Yes, that's actually the average age. What is menopause? Menopause? So 12 months without a period, but the real changes start before that. Perimenopause, 4 to 7 years before. This is when hormones fluctuate wildly. Estrogen goes up and down, progesterone fluctuates. This causes mood swings, irritability, anxiety, fatigue. Common symptoms: hot flashes, poor sleep, brain fog, low energy, low libido. Why it happens: estrogen affects brain, heart, bones. Mood: when levels drop, symptoms appear. What you should do as a partner: instead of ignoring it, say, "I'm here for you. Want to talk to a doctor together?" Support matters more than you think. What helps? Good sleep, exercise, balanced diet, stress management. Hormone therapy can also help, with doctor guidance. Final takeaways: waking up once at night, said normal, more than once. Investigate gas station pills, sign unsafe. ED, health warning sign. Menopause starts around 50. Support your partner. It matters. Outrow. If you found this helpful, make sure to check out more Ask Me Anything episodes where we answer real questions like these in depth. And as always, take care of yourself, because your health matters and you're worth it.